Bonjour et bienvenue à...
Hello and welcome to today's live video session about COVID-19. I am Bruce McFarland, and I am in company with Dr. Jennifer Russell, the Chief Medical Officer of Health of New Brunswick, and our friend in Edmundston, Dr. John Tobin, the Department Head for Family Health, Family Medicine in Zone 4. Thanks for being with us at this video session to discuss COVID-19.
Welcome to today's live stream. My name is Bruce McFarland. I'm here with my good friends, Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and our good friend up in Edmundston, Dr. John Tobin, the head of the Family Medicine Department in Zone 4. We have lots of questions to get to. We have a good half hour because we have a press conference coming up at 3 o'clock that was just called. So I want to start off right away. J'attends la discussion en posant.
Let's start right away by asking this question to Dr. Tobin. Can you tell us what the situation is in your zone, Zone 4, please, Dr. Tobin?
Merci.
Certainly, we are hit rather hard with the outbreaks, but at the hospital, things are going, we can say that's going a little bit better. As the days are going by, in intensive care at this time, we have 4 patients. 3 of them are being ventilated. The 4th one is still in intensive care because she had complications, or he had complications. At the COVID unit, we have 7 of them. They are stabilized. They're doing better and better. They're slowly recovering. And of those 7 patients, it should be said that the 2 patients that had been transferred to Fredericton a few weeks ago are now back in Edmundston in the COVID unit. So as I say, things are going better, and we're hoping to perhaps be able to release one from the COVID unit. When it comes to the zone itself, of course, we have outbreaks here and there. In the long-term care homes at the St. Jacques area and the long health care center, they're pretty much under control. And of course, we've heard of the outbreak in Grand Falls, but at that in that establishment, most of the patients have been vaccinated already, so we don't think we're going to have any extremely sick people there. So it'll be hard to see how many people may have to be treated, but still, we're rather confident. On a positive note, when it comes to today's vaccination clinic is full with 500 patients. Yesterday, we found 438 appointments made out of 540. So that's rather impressive for the number of patients that we'll vaccinate. And it should be said that the vaccines left will not be returned to the province nor to the federal government. We will be using them in clinics next week. Great. Thank you, John.
Questions, and there were a lot of repetitions of questions about vaccines and other stuff. So we're going to get right into it. So the first question is, for patients who are can you say the word for me?
Immunocompromised.
Thank you. 4 months between the first and second dose could be problematic as our immune systems are not as good at responding to the vaccine and require their second vaccine sooner to achieve optimal effectiveness. Is New Brunswick going to take this into consideration when timing the second doses of the vaccine? Dr. Russell?
So obviously, great question, and I've heard that question myself actually. And so obviously, there are conditions that put individuals at a greater risk for poor outcomes of COVID-19. They also put people at risk for not having an optimal immune response to the vaccine. So the approach that we're now taking really actually helps to protect those individuals from their own vaccination, even if it's just partial, and by vaccinating those around them, which means that we're possibly decreasing the spread of the virus in the community. And there is a process for healthcare workers to make a request for an exemption an exception rather, but this is very rare. So it's really important that every one of us, even those already vaccinated, continue to do all we can to prevent the spread of COVID-19 and its variants.
Thank you. Here's another question that came in. I haven't seen this one addressed. What happens to the people over 55, 64 who got the AstraZeneca dose last week, and now we're here that India will not be sending any pre-planned doses to Canada? Where is our second dose coming from? Are there any backup plans?
So the Government of Canada is working on securing all the vaccines that we need for Canadians, and the decisions around which type of second dose people will be offered really, again, for people who have had their first dose of AstraZeneca, that's going to be determined on evidence and research. We are waiting for some data that's coming out of the UK on that.
Bruce, si je pourrais rajouter,
If I can add, certainly the same question is being asked in our zone for people who received AstraZeneca who are under 55 years. And I think the answer, we can tell them that their second dose, when it's time to get it, we will have to wait and see what Health Canada will tell us as to the type of vaccine we could give when it comes to the second dose. And we will give a second dose of whatever is recommended by Health Canada.
Conference, there are studies going on
In the UK.
in the UK
Yep.
about this precise thing.
Yep.
I do listen at the news conferences. Quand le personnel, les enseignants, les...
Okay. When it comes to kitchen people, school bus drivers, school cafeteria workers, teachers, health teachers, will they be able to get their vaccines, even in Zone 4? Well, in Zone 4, we decided that we would vaccinate teachers at the high school level. Certainly, that's because we were expecting to have all the high school students in school. At the elementary level, the system is a little different. I don't think that the teachers there are any more sheltered from many of their clients, but certainly we would like to prioritize all those people as quickly as possible, but we have many people who are even more of a priority right now. So unfortunately, we are prioritizing people who have to be vaccinated even sooner. On the other side, we should not become discouraged, because by the end of June, everyone should receive their first dose. And if we see how things are going in our zone, there are chances that might be even well before the end of June. I think that most of the people will be vaccinated by mid-June, and that's in 2 months from now. Yeah, okay. Certainly, it's going to take until the end of June to have all people have their first dose, and the elementary school staff and those in the middle schools will be vaccinated according to their age cohort. But of course, in Zone 4, we've sped up the time by which they can be vaccinated for the people who live in that zone. And the strategy currently, those strategies in place, we've been doing mostly the schools and the preschool centers, and we want to give several levels of protection for our operational work. So we want to continue for now to have a physical distancing, wearing a mask, washing hands, doing regular cleaning. So, okay. At the primary and middle school level, we are using a different approach because the measures will not be perfect throughout all the schools. So we have other measures.
19 after being fully vaccinated. What is the end goal of the current vaccinations? How will the vaccinations help slow the spread? There's lots of conflicting information out there. and I'm just confused. So we'll start with Dr. Russell, and then we'll go to Dr. Tobin. I know he's got some comments to say, so I'll start with the chief.
Yeah, so we are learning more every day about COVID and the variants of concern. And throughout the pandemic, we've always had the goal of reducing the risks to our healthcare system. And really throughout the pandemic, and even after once everybody is vaccinated, that will still continue to be our goal. Health Canada has approved vaccines that are effective at protecting against severe illness and death from COVID-19. And so all the vaccines that we are providing citizens with right now do that. Not quite 100%, but pretty close in terms of protecting people against severe illness and death. And that is, again, that's our main goal. So vaccinated people can have symptoms. They can be mild, they can be asymptomatic, but you can still get COVID if you've been vaccinated. And again, you can have mild symptoms like a cough or a sneeze. You are shedding fewer virus particles, so hopefully that lessens the transmission. We're still learning about that as well. And the clinical studies out of Israel actually show vaccinated people who develop COVID-19 presented with a viral load up to 4 times lower than those not vaccinated. Now, I actually was on a phone call with Israel this past weekend with my counterparts around the country. And in Israel, they have a large amount of their population, I think maybe 75% of the population vaccinated with 2 doses of the mRNA vaccines. And that's going really well, and it's really a good amount of information to show us what can happen after we're all vaccinated with our 2 doses in terms of how many cases they have and how many people still get hospitalized, et cetera. Much, much, much lower. So again, immunization is part of that multi-layer approach of physical distancing, mask wearing, hand cleaning, and keeping your contacts low and your constant or your steady 15.
Dr. Tobin, as-tu quelque chose à ajouter? Je pense que oui.
I think you have something to add. Yes, because I think we have to stop being confused when it comes to that. One thing we know is that vaccination will prevent us from developing serious COVID-19. That means that they won't be hospitalized in the intensive care units or to be ventilated. And Israel is showing us information about this, is that vaccination is probably going to show us that it reduces contagion, it reduces the fact that we might spread the disease to others. But now we see on social media comments such as, well, it doesn't work. No, that's not true. It prevents us from dying from that. That's the first thing. Second thing that I hear is that, good, being vaccinated, well, we're being given the virus or we're given the disease, and so we'll give it to someone else. No, that's not what it does. The vaccine does not give anyone the disease. It does not give the variant. It protects us from COVID and the variants. So far, that's the case. The screening doesn't cause the disease either. So you have to think that people who are those who are vaccinated wind up being in a hospital. That's not true. Last week, I had one person hospitalized who had been vaccinated, but it was for reasons that had absolutely nothing to do with COVID. When it came to COVID, there were no new hospitalizations of vaccinated people. The vaccine protects, so we have to stop being confused. The vaccine is safe and effective. We have to be vaccinated. Très bon point.
Yes.
Tobin. Prochaine question.
Next question. Will more AstraZeneca vaccines will still be offered in New Brunswick? I want to make an appointment, but I can't find the information about this.
The vaccine available in New Brunswick again. I can't find any information to book an appointment. Dr. Russell?
Alors, avant de...
So, before answering the question itself, I want to thank all people who have already been vaccinated. This is truly encouraging, and vaccination will protect people around you as well, and it protects you from the more serious effects of COVID-19. So when it comes to making appointments in the many clinics, they're all the appointments have been booked, but we should be getting more AstraZeneca by the end of May. But between now and then, we have other vaccines, Pfizer among them.
Eagerness to get vaccinated, it's quite amazing and encouraging. Obviously, getting vaccinated protects you from serious illness, and it protects those around you as well. So there are some appointments that are available for AstraZeneca, and many clinics are now fully booked. And at this time, we do anticipate our next shipment of AstraZeneca to be in late May, and we do expect more deliveries of the Pfizer vaccine between now and then as well.
So,
Donc c'est facile à dire.
So it's easy to say that your turn will come soon.
doctors, merci beaucoup.
Another question. How can we protect vaccinated people in our zone, in Zone 4, as of today? So, as of this morning, 41% of people aged 16 and over who have been vaccinated. Good statistic, Nick. Right, John? But with the vaccination clinics of today and tomorrow, I think we're going to reach 45%. This is very good news. If we look at the statistics nationally and internationally,
Vite, là. Ça va bien. En mots.
things are going very well. No, but really, I am really happy with what's going on. But all the same, there may be 1 or 2% for patients that develop COVID and have developed a natural immunity as well. But that's rather minimal. Next question. When we have a region affected as ours in Zone 4, shouldn't we open vaccination to all people in order to limit contamination? Well, we're losing tested methods to go against this disease, and we are continuing to do contact tracing to reduce exposure, etc. And given the limited number of vaccines, we are concentrating on the people that are most vulnerable and those who are at risk of having a very serious complications or hospitalized or even in the intensive care. Those that are vaccinated protect themselves and others. And this will protect also the regions that haven't been touched by this, and we want to support all people in Zone 4 with our teams that will be working with the daily follow-up and contact tracing, as well as with our prompt teams and our other partners in healthcare. To maintain this support, we have to prevent outbreaks in other areas as well. Certainly, we would like to be able to vaccinate everyone as quickly as possible at the same time, but the reality is we only have so many vaccines per week. We are giving them as quickly as possible, and I assure you that when we say that there's 1,000 vaccines in 1 week, well, the following week we give another 1,000 vaccinations. We're doing this as quickly as possible. We will be reducing the age groups as well as quickly as possible. It's just that right now the quantities are limited, and we have to protect the most vulnerable people first. Exactly. What is the percentage of people that are COVID positive that update the Alert COVID app? Is this done voluntarily or is this mandatory? Dr. Russell. So the Alert COVID application is a free app which can be used on volunteer basis, voluntarily. We are encouraging everyone that has a cell phone to download it and to activate it so that they can check for COVID, so that other people who may have been around them can be informed, so that they can be self-isolated and be tested.
Alert app is free, voluntary, and it's a notification exposure. it gives a notification exposure. So we don't have the actual percentages right now, but a total of 9 provinces and territories have onboarded the app, and more than 6.4 million have downloaded the app. We just don't have a breakdown by province, and there are 28,000 one-time keys have been used. And keys are only given to those who test positive. So public health would ask the person if they have the app, and if they do, they generate a key for that person and then communicate to the patient and ask them to enter it to their device at their as an option. And we encourage everyone with the mobile app to download it. With a mobile phone. We encourage everybody with a mobile phone to download the app and to activate it, and in the event that you test positive for COVID-19, to enter the one-time key in the app so that others who have been near you can be notified so that they can self-isolate and get tested.
John, do you have the app?
Yes, I do.
Doctor?
Yes, I do.
C'est sûr que c'est
Certainly that the more people who have the app, more people will be able to be notified. But the problem is it's voluntary, and if the people don't use it, well, we can't be alerted. And there's a false belief that we are giving information in our phone and it'll be available to everyone. But no. It's entirely confidential. Nobody will know who has what. Okay.
Oh, I don't know. I think I made them download it. I'm
Good.
pretty sure.
Put you on the spot.
Yes.
Do you think we'll be getting our second shots sooner than the 4 months?
So I definitely think there will be a certain amount of the population who definitely will get it before 4 months. And it's really all based on the fact that New Brunswick has an allotment that comes on a per capita basis from the federal government. And so we know that more vaccines are going to be coming available later in May and early June. And once that starts, we'll have even bigger and bigger amounts of doses available. So there have been delays up until this point and changes in vaccine availability, but we're really confident right now that every New Brunswicker will be offered their first dose by the end of June. And then we hope that everybody will have their second dose on board before the fall. So the second dose clinics may be changed based on vaccine availability, and that's for sure. So if you're one of those people that gets vaccinated mid to late June, and you're thinking, we're thinking that we're going to get everybody with their second dose before September, then for sure you'll be getting your second dose before that 16 weeks. But we're committed to giving that second dose between a maximum of 14 and 16 weeks. But for some people, it definitely will be less.
il y a deux choses importantes.
Two important things I would like to add. Certainly, Health Canada has approved that we give the second dose within 4 months, within 16 weeks. So it's safe, it's effective to do that. Secondly, I have many questions that I hear. Well, how can I make sure I get my second dose? Well, public health knows who received their first doses. They will receive either an email or a phone call to schedule the second dose.
Hearing is people going to find clinics, and I know you've been saying this, and I believe the Premier alluded to it yesterday. If you know someone who doesn't have a computer or is not computer savvy, help them out. Maybe go online to the coronavirus website and go click on the RHA clinics and help your friends or neighbors or family members to book a vaccine. So check in on your neighbors and see if you can help them out. I think the more we can get vaccinated quickly, we'll all be better off.
Exactly.
And there's a lot of people volunteering to help out too. So check the social medias and find people that do.
Perfect. We're coming up towards our last question or two. So, est-ce que les surgeries
will, for surgeries, start again in Edmonton, even though there are still 90 active cases? Will we, Dr. Tobin? Certainly, the lockdown, the red phase, has forced us to postpone surgeries that are elective. So theoretically, they can wait. Of course, this causes more delays, but what's important is that all urgent surgeries are being done, or most of them for cancer are being done regularly. There's almost nothing delayed when it comes to cancer surgery. That's very important to remember. If there's a surgery for cancer or any other urgent type of surgery, it goes ahead. And we know that there are people who are waiting and who are suffering in pain to have a knee or hip surgery. We know that. We don't like having to postpone them, but we have to because staff has been assigned to other tasks and we don't have the people needed for post-operative phase, but we should be able to start a new line of surgery, and we will start doing some that don't necessarily require hospitalization. We're trying to catch up as quickly as we can, but yes, surgeries are on their way.
Question which you guys don't know about is, can you comment about the variants and what we're seeing and what's sort of heading our way, Dr. Russell?
So the variants of concern have really been playing a huge role in what's happening in Zone 4 right now because we're dealing with the UK variant. Variants of concern all meet the same criteria in terms of being more aggressive than previous strains, causing more severe symptoms, requiring more people to be hospitalized, requiring ICU admission and ventilation, and causing more deaths. So we're seeing the UK variant here. We've seen some cases of the South African variant and other places in the province. We are very worried about the newest variant, which has 2 mutations on it that make it more concerning than all the others, and that's the Indian variant. So as you know, at the federal level, they are stopping flights from India right now as a result of that risk, and we definitely want to be on the lookout for that, and that's why we need to be as vigilant as possible because outbreaks involving variants are harder to contain and take longer to contain, and we want to protect everybody with their first dose of vaccine before we really run into too much trouble, and we really need to continue to protect our hospital system.
John, Dr. Tobin, as-tu quelque chose à...
Anything to add, John Tobin? Yes, and you can call me John, no problem. Look, no problem. It's okay. I like to be called John. What's important to remember, and it's very important, until we find out differently, the vaccines we have are still effective against those variants. I mean, so far, we haven't been able to show that the vaccine did not work against the variants, even the one from India. Until otherwise notified, it seems to work. So it's very important to be vaccinated. We're trying to prevent outbreaks. We're trying to stop those viruses from causing us problems.
Doctor, before I close it off?
Je voulais juste remercier tout.
I just want to thank all the people in Zone 4, the leadership and the mayors and the MLAs. We've really had great cooperation with all the organizations throughout the province to support us. And we have hope that we will be able to get through this challenge as quickly as possible. Okay. And Dr. Russell, I've gotten many messages. They were saying that they want to thank you for the work you're doing for our zone. It's very appreciated, certainly you and your team, because I know you're not alone in all that. And you, Bruce, who are also working very hard, and the committees. Thank you very much from our zone. Thank you. Okay, thank you, Dr. Tobin. Thank you, Bruce.
C'est tout le temps.
Well, that's it. That's all the time we had today. I hope we'll be able to do that again soon with Dr. Tobin and Dr. Russell.
News conference. We have a news conference coming up in an hour. So I want to thank you, Dr. Tobin, Dr. Russell, and everyone out there. And hopefully we can get to do something like this again real soon. Merci
Let-
beaucoup.
Thank you very much.